This meeting comes at an important moment as Eastern Africa works to align regional priorities with the Africa health security and sovereignty agenda and to strengthen resilient primary health care, immunization, community engagement, and epidemic preparedness.
The Africa Health Security and Sovereignty Agenda is Africa's vision to strengthen the continent health security, resilience, and self-reliance.
We in Tanzania, we know this is a huge responsibility and the most trustworthy item we have been given so that we can support others who are also trying to meet the SDG goals by 2030. And with this championship, there's a lot that needs to be accomplished. As you have read the roadmap, it has three ambitions. One is having zero preventable maternal death. The second being having zero home delivery. And the third having a zero unvaccinated child.
These challenges present an opportunity for Africa to strengthen its resilience, for Africa to deepen its collaboration, and indeed accelerate Africa health, security, and sovereignty agenda.
The problem of emergencies is only one. At the time emergency happens, all priorities of the countries are reorganized, and everybody is talking about emergencies, and it's a problem we have now. Resources are reprioritized, the actions are reprioritized, and also a political agenda is also reprioritized.
This is our shared commitment that UNICEF stands and shares with African member states, with Africa CDC, with WHO. Let us truly seize this moment all together in this forum with a sense of urgency and solidarity in terms of really pushing forward this agenda in a way that is measurable and tangible.
The priorities pillars is something very important, especially to South Sudan. We started with the advocacy, the one of the main pillar to advocate with the big people to support the immunizations program. So one of this we able to take a step, although the things was not been yet, but we already ahead because we have an issue of vaccines, traditional vaccines. The traditional vaccines one of our challenge, and I think we started the advocacy. There is a team even able to go up to the president level so that to finance the traditional vaccines.
Through the Center for Advocacy and Policy and also through the Center for Vaccine Innovation and Access, we are actually advancing vaccine and immunization equity through innovation, evidence and policy to make sure that we reach the underserved communities. So from our work across the Eastern African region, we have learned many lessons, but one key lesson is that, zero-dose children are not missed because they do not exist. It's actually because the system does not see them well or well enough, and that is where we actually need to begin the conversation.
Self-reliance has been the underpinning discussion in the 8th ReTAC. There were 14 countries that were represented in this meeting, and it was very clear that we need to increase domestic financing and stop reliance on overseas funding.
One thing that PATH has done in working together with the ministries of health in these countries is really just to see how we strengthen infrastructure systems, including cold chain equipment and storage, and also equipping community health workers and other healthcare worker cadres with the tools that they need to be able to do their job.
This continent, we deserve the best. And who can bring the best is not anyone else. It is me and you. So all Africans, we need to unite to bring changes. A positive change whereby a woman and children in Africa will feel to be safe when managed in our health facilities.
So we're drawing to a close, and I'm sure everybody's excited. But I think all of us have gained weight because our brains are now filled with so much information from the 3 days of engagement. And importantly, I'm hoping that that information doesn't stick as information, but it translates to action.